Cool. Well, Kat, I'm sure you'll do a little intro. And Kim, did you get to meet Kat during training or not?
No.
Okay, cool.
I've taken one of Kat's classes, but I was like one of 40 people. So
Yeah. Awesome. Well, this is our dear friend and teacher, Kat Allen, and she's graciously offered to spend an hour with us and our tribe talking about a really important topic and something that she's just so thoroughly knowledgeable about and passionate about from what I know of you, Kat. So, and it's super wide open to questions. And Kat, I don't know how you feel about people stopping you during the presentation or if you want to wait till Q&A, but I'll let you kind of guide what you want the conversation to go like.
Okay. Well, thank you for having me. I'm taking this as we are officially starting. Is that right?
Okay. Yeah. And Kat, I don't know if we created this with you or not, but this is also part of our My Tribe community. So a lot of people who couldn't be here will also see the video.
Okay.
And you know, our commitment is just to connect people to really great resources and teachers and people. So we're going to do our effort to pass it on and make sure the information gets to as many people. There's about, what would you say, 30 people right now in the community. A lot of students who are either in different cities around the country or have done trainings or wanted to stay connected to the source of the work. So we'll make sure that you connected to them too. And I'd love to hear about any offerings you have toward the end or whenever you feel is appropriate, because people are seeking extra training and certification. So feel free, just this is your time, go for it.
Thanks. I would like to warn everybody that I have animals in the house and they like to talk. So you might occasionally hear my dog Chester or one of my cats clawing at the door and meowing. You might even hear my daughter call me. My husband, they might come in here and be like, the house is burning down or something like that. And I'll have to just address it right away. But hopefully the house won't burn down.
You're all good.
I'm here. Thank you.
Hi, Clay.
Hey, Clay.
Hello.
Hi. Where are you right now?
I'm just leaving my yoga class. I'm in my car headed to the house.
Okay. Well, I'm here to talk about yoga for pregnancy and postpartum. I will make time for Q&A after the presentation is over. If there's something that you have a question about during my presentation or you have a comment, I would like for it to wait until after the presentation just so I can get through the information. However, please do stop me if there's something that I say you don't understand or you need me to repeat it or clarify it. I'm happy to do that. So please interrupt me for clarification. I'd like to start off with how to adjust a yoga practice for pregnancy. And these are some basic guidelines. In the first trimester, if the yoga student who's pregnant is feeling tired, nauseated, digestive issues, definitely modify the practice according to what their abilities are. But if they're not feeling any different than before pregnancy, they can actually continue their yoga practice as normal. And there's a lot of fear-based information out there in the world, like as soon as you're pregnant, all these things you just cannot do. And I think that fear-based information is not very grounded in evidence-based research. It's I don't know where it comes from, quite frankly. I think that it's crucial that the pregnant person listen to their body rather than listen to all of these people trying to project their fear onto them. So first trimester, you can do anything you want. You could be on your belly. You could put pressure on your belly, with the exception of second and third and fourth pregnancy. So this is really just for first-time pregnancies. In second, third, and fourth pregnancies, sometimes the womb, the belly distends farther out sooner. And that's like as soon as the pregnant person has started to show, even if they're in their first trimester, then don't put pressure on the belly. Like boat, with the belly on the floor, and you lift up and do your baby back bend. It's really important to walk as much as possible throughout all the trimesters. So a lot of very gentle calf lengthening, hip opening, like high squats, chair pose, for example, can be very good for first trimester pregnancy. In the second trimester, if the pregnant student had been feeling nauseated or fatigued, their energy usually picks up by the second trimester, with the exception of some pregnant people who feel nauseated, like severe nausea throughout all the trimesters. And we can talk about that in detail in a moment. But usually they can start doing things like, if they're vinyasa students, they can start doing modified vinyasas. By second trimester, they're already showing. Most of them are already showing. Definitely no traditional ab crunches or deep twists, deep back bends. If you want to modify a vinyasa, then there are so many options. The sky is the limit. You could do like plank into modified chaturanga, into cobra with a rolled up mat under the pubic bone so that there's no pressure on the baby, or cat-cow to downward facing dog, or pelvic tilts on hands and knees into downward facing dog. If it's later on in the yoga practice and they're really hot and warmed up, then they could do things like baby camel back bend and then downward facing dog. And the sky's the limit, like I said. Those are just some examples of how you would modify a vinyasa for a pregnant person. If your pregnant student is experiencing any dizziness, avoid up and down postures like sun salutations. Those need to be modified. In the forward bend in a sun salutation, then hands on their thighs in the forward bend. So it's just like a halfway forward bend. Third trimester, the belly now theoretically is at its largest, and it's going to continue to grow larger. So forward bends should be, the baby should be accommodated by separating the feet wider, about hip width or sometimes mat width apart. There are three main guidelines for pregnant people, no matter what trimester they're in. No holding of the breath. No pressure on the baby. If it feels wrong, it is wrong. Those are three really safe guidelines to follow. Now, there are nuances to these guidelines. You know, pregnant women can swim. Obviously, they can hold their breath underwater without hurting themselves and their baby. Unless they have high blood pressure, they shouldn't be holding their breath underwater for long periods of time. But we're just talking about in the context of a yoga class here. So no holding of the breath. You don't know if your student has high blood pressure, and sometimes in a group class, you don't find out. Maybe they don't offer up that information, and there are just too many people in the room to interview each individual person about their medical history. It's just much better in a group class situation to stick to poses, pranayamas, and transitions that are generally okay for pregnant people. The most common issue that I see in a yoga practice that a pregnant person is doing is hypermobility, exploitation of hypermobility. When you're pregnant, you produce and release this hormone called relaxin, and it's meant to basically make your joints, your connective tissue, more flexible so that when you deliver your baby, your pelvic bones open up enough to allow room for the baby to move through. It also helps to relax the uterus so that the uterus doesn't contract prematurely. We don't want the uterus contracting prematurely before the due date. Relaxin is a very important hormone, and because of its presence and because of imbalance in our bodies today due to modern technology, sitting computers, it's very easy to exploit relaxin and do poses too deeply, too deep of twists, too deep back bends, too deep forward bends. While it may feel easy for a pregnant person to do, it's not necessarily something that the pregnant person should be doing. Because going in too deeply into poses can further destabilize their joints and cause even more imbalance in their muscle tissues. So teach your pregnant people how to build stability in their joints. Standing poses can be great. Baby back bends with no pressure on the baby. Mild twists, really good for massaging out back tension. And improving breathing too. Twists are great for improving breathing. I think a lot of yoga teachers wonder if pregnant students can go upside down, and that is a very, on a case-by-case basis. If the pregnant student has been doing yoga for a very long time and inverting since way before pregnancy, then if it feels right, the student can invert. When the student is in their third trimester, keep the inversions to 30 seconds or less. Inversions alone do not flip a baby. It's actually very hard to flip a baby. A lot of pregnant people or yoga teachers are afraid of accidentally turning a head down baby to head up. And that's what we would call breech, when the baby is head up and the feet are pointing toward the vagina. A lot of pregnant people desire to have a vaginal birth. And in today's medical world, if you're going to have a medicalized birth, OBGYNs prefer that your baby be head down, which means head point toward the vagina. That increases the chances for a vaginal birth in a hospital setting. So I understand that fear. I respect it. Know that inversions themselves don't turn babies. In order to turn a baby, you've got to invert between 5 and 20 minutes. And most people do not even invert for a minute. So I'd say one inversion a day for up to 30 seconds is okay, unless they have high blood pressure, shoulder pain, back pain, and any other issues that would be exacerbated by going upside down. So I want to expand on inversions. The uterus, the womb, it's not like this water balloon where the baby just settles where gravity takes the baby. The uterus is actually shaped by the length and the tensions of the uterine ligaments. And ironically, inversions, if they're done correctly, can help to balance out the uterine ligaments to make more room in the bottom of the uterus for baby to go head down. So the biggest part of the baby is the head, and the head is just going to fit inside the uterus where there's the most room. So there is a specific way to do the inversion. If you are interested in learning about the inversion, then go to spinningbabies.com and look up forward leaning inversion. I'm not pregnant anymore. I actually teach forward leaning. I do forward leaning inversion still. It's really great for helping to relax the pelvic floor, and every human has a pelvic floor. So whether you're pregnant or not, check it out. You do need to read all the information about forward leaning inversion, and I'd say consult with a yoga teacher who's experienced with working with pregnant people before you decide to teach it to your pregnant student. Meet your pregnant students where they're at. So modify for any conditions or symptoms that the student may be experiencing. Definitely do that. Beginner pregnant students, they must do a beginner yoga pregnant yoga class. Intermediate and advanced students can do an intermediate advanced practice if that feels correct for them, or they take it easier, they down level. You've got to teach your students to listen to their bodies instead of trying to push through and meet some sort of expectation or pressure that they're imposing on themselves. Don't assume that a pregnant student needs to modify just because they're pregnant. And it's okay to not know what your pregnant student needs. Just ask them, what do you need? If they don't know the answer, then both of you as the teacher and the student, can work together to experiment. And then ask, does that feel better or not? I'd like to move on to the postpartum phase. And I think the number one question that I get about postpartum is, what kind of core work can I do? The kind of core work that I'm about to go over can also be applied to pregnancy, not just postpartum people. Core work is essential for this day and age. It used to be that we didn't need core work because we moved a lot more. Nowadays, we have chairs, we have computers, we have cars, we sit more. And because of that, and we have iPhones, because of that, our cores have weakened tremendously. So we do need to do core work. It's just like brushing teeth. If you had a pristine diet, you would never need to brush your teeth ever. But we don't. The quality of our food has, I think, gone down, and also we're moving less. So our our nutritional needs through eating and moving and feeling are at a deficit. And that's why we need to fill in those gaps with things like brushing teeth and doing core work. The core work does need to be modified for pregnancy. Starting around maybe the mid-second trimester and all the way through third trimester, lying down on the back for long periods of time may not feel very good. It actually might cause the pregnant person to feel dizzy. So consider doing abdominal work in a quadruped position on the hands and knees, like pelvic tilts, opposite arm and leg lifts, Sometimes cat-cow feels good for pregnant people and postpartum people. Core work on the side, like side plank, for example. And if a pregnant or postpartum person wants to do core work on their back, like they feel fine being on their back, they don't feel dizzy, lightheaded, their breathing is very steady and smooth, then do core work with moving the legs around. And there's so much out there. You can Google it and look up core work for pregnant and postpartum people. I haven't seen it all, but I've seen some good stuff out there. When I was pregnant, a lot of the core work that I came up with was for my own pregnancy, and the ones that I really wanted to go back to over and over again were the hip openers and the ones that where my legs were moving while I was on my back. It really helped to stabilize my joints and to help me to breathe better, which is so good for baby too. All right, so let's actually go into core work for certain conditions that might occur during the postpartum phase. The number one core exercise that I want you to coach your pregnant and postpartum people to do is conscious full breathing. If you did that, if any human did that throughout their entire day, they would not need to do core work. The reality is, most humans don't do that. However, it should still be emphasized. And what I mean by conscious full breathing or conscious deep breathing is at the very start of the inhale, relax the belly out. And for the duration of that inhale, feel for expansion in the back ribs and the side ribs. When it's time to exhale, softly contract the abdominal muscles and the rib cage muscles. And the key word is softly. It's not a clenching. This is a great way to condition and tone the pelvic floor, as well as the transverse abdominis, those intrinsic core muscles that need to be integrated well in order to ease childbirth and postpartum healing. Dan and Christina, can you still hear me? Let me see.
Yes, you're good. We're just on mute.
Okay. I heard some strange sounds from my earpiece. So in fact, I'm going to take them out and use the speaker on my phone next in case. Okay, can you hear me?
Yep, you're good.
No, you can't hear me.
Yep, you muted yourself.
Mute now.
There
Okay,
you
can
go.
you hear me now?
Yep,
Yeah.
you're good.
You can hear me? Okay, thank you. All right. So conscious deep breathing, the most important. And that means that you need to coach them throughout all of the yoga practice to feel the ribs open. The ribs have to expand tremendously, at least 4 inches to make room for the baby. So if the rib muscles are very tight and there's no room for the baby to rise upward toward the chest, then the baby will be pushed downward toward the pelvic floor. And what that does is it increases intra-abdominal pressure onto the pelvic floor, therefore making it tighter. It freaks out the pelvic floor. And that's the last thing we need for childbirth, because the pelvic floor must be able to have the resilience
and elasticity to stretch open for the baby to travel through. So focus on opening the ribs while relaxing the belly out. It also makes room for the baby to go head down. And for postpartum healing, deep breathing, you don't need all the other fancy core work. It will help to knit the abdominals back together. That exact technique that I went over. Open the ribs. And it's not thrusting the ribs forward. I don't think it's enough to say don't thrust your ribs forward. I think it's much more effective to, as a yoga teacher, if your student gave you consent to put your hands on their back, then put your hands on their back ribs so they have some kinesthetic feedback, and coach them to open their ribs into your hands. On their own, they can use an elastic band and loop it around their rib cage, not around their baby, like right under the breast tissue above the fundus of the uterus, and get the ribs to open up into the elastic band. Stop the inhale before they feel an urge to lift their chest or clench up around the collarbones or neck. So the breath might feel shorter, that's fine, but we're going for quality open breath. And in case that wasn't clear, you can do that postpartum as well. The main piece for postpartum core healing is to relax the excess tension and support the slack to create more balance in the body. Issues that might arise after childbirth include diastasis recti, prolapse, incontinence, both urinary and rectal. Hernias, that's a common one too. So what I'm about to go over will address, in general, those conditions. Diastasis recti is really not an issue until maybe, depending on which provider you work with, it's not an issue until about 6 months to a year after you give birth. Some people say 3, some people say 6, some people say longer. So I think it's all very subjective. DR is when there's a gap between both sides of the rectus abdominis. And there's a way to test for it. You can lie down, lift your head up, tense up your abdominals, and try to stick your fingers into the midline. If your fingers fit in, you feel a gap, then you probably have DR. Now, having a gap in your abdominals is not necessarily a problem. Gaps can sometimes lead to chronic back pain and other medical conditions in the core region, in the pelvis, around the spine, around the heart. So insurance companies have to establish it as a condition and define the gap. It's like something millimeters and it's DR. Then you would be qualified to have surgery, for example. But know that we're really looking for function here. If you don't have back pain, you can breathe well, you're not peeing on yourself, you're not pooping on yourself, and I'm not joking, in all sincerity, it's like a gap is fine. You don't need to be concerned. DR is not just diagnosed by the width between both sides of the rectus abdominis, but it's also diagnosed by the depth. So how deeply do your fingers sink down? The more deeply your fingers sink down, that means that your TA, your transverse abdominis, it needs more strengthening. When it's very, very weak, your DR depth is very deep. So the stronger, the more integrated, and I don't really like using the word stronger, but the more integrated your TA gets, the the more shallow the DR depth is, and that's a good thing. So these problems that come up after you give birth, it's not because you gave birth or because you were pregnant. It's actually because of an accumulation of lifetime patterns and habits that have had the final straw, and they're showing up. They're way more obvious. So it's not like you all of a sudden have DR. You probably had excess abdominal tension before you were pregnant for various reasons. And now the connective tissue has deformed to the point of being very obvious to you. But it doesn't mean it's a brand new thing. And that's what DR is. It's the connective tissue thinning out. A lot of people think that DR is the gap. But the gap is there because the connective tissue has thinned out. The goal is to bring more density into the connective tissue to bring both sides of the abdominals together. The kinds of tension, excess tension that that leads to the formation of DR or prolapse when your organs get pushed into the wrong place inside of your pelvis, prolapse. Those excess tensions show up in the back, the shoulders, and the pelvis. So instead of thinking of your core as being weak, think more about getting rid of excess tension. Do more exercises and poses that increase the range of mobility in your shoulders, hips, and legs. And that will help to reduce the excess tension in your obliques, for example. When there's excess tension in the obliques and the rectus abdominis, that is what pulls and tugs on the connective tissue at the midline of the core. So when we add more mobility into the shoulders, legs, and hips, it literally takes pressure off of the obliques and the rectus abdominis. It's like that annoying coworker who never does his or her job, so you have to do all of it. Teach the shoulders, hips, and legs to do more. Absolutely no crunches in postpartum, even in pregnancy. I don't think crunches are useful in the postpartum phase. And by postpartum, I don't mean just 3 months after giving birth. By postpartum, I mean for as long as necessary. You are definitely postpartum for as long as you're lactating. There's still relaxin in your system when you're lactating. And it can stay in your system for anywhere from 3 to 6 months after you finish lactating. And I know lots of yoga people who want to breastfeed their babies for 3, 4, 5 years. Well, guess what? You're postpartum for 3, 4, 5 years. So I don't recommend lifting your head and shoulders off of the floor until well after you've stopped producing milk.
Kat, I have a clarifying question.
Yes, I can't hear you very well. Can you speak closer to the microphone for me?
Yeah, is this better?
Let me see. Hold on, maybe it's my phone. One moment. Hello?
Can you hear me well?
I can hear you much better. It was my phone. I didn't have you on speaker.
So when you say crunch, are you correlating that to lifting the head in an abdominal exercise, not the act of shortening the front line of the body?
Well, the front line of the body is shortened even when the head is on the floor. But the problem with lifting the head and shoulders off of the floor is that it can increase intra-abdominal pressure, which is what we don't want for postpartum people who have these issues like, pelvic floor disorder, DR, incontinence, prolapse. Did that clarify it?
Yeah, no, that's great. I think I had never considered, to me, when I hear the word crunch, I think kind of like the old school ideology of a sit up, right? So I was thinking,
Oh, right.
I was
I
thinking,
also, yeah.
I was thinking specifically to the belly. So this is super informative to correlate crunch to lifting head and shoulders, to not increase that pressure. So that's awesome.
Yes, thank you for asking that. I'm also including, you know, I'm all about forest yoga. I love forest yoga. I'm also including forest yoga abdominals. That's
Yeah.
lifting head and shoulders. It's too much force on the pelvic floor.
Yeah.
Force and pressure.
So does this also go for older women who are experiencing prolapse and incontinence, not just postpartum?
Absolutely. And men too.
Yeah.
And men.
Yep. Okay. Thank you.
You're welcome. Pelvic floor toning in the postpartum and for pregnancy too. So teach your pregnant people and your postpartum people how to stand in Tadasana. The way we stand and the way we sit has a bigger impact on our bodies than doing half an hour to an hour of yoga a day. The way we breathe has a much bigger impact than what we do on the mat in our yoga practice. What I would hope for yoga students is that they use those tools that they learn and feel through on the yoga mat to apply it into their daily life. Because all those mundane activities that they do affect their bodies way more, like standing at the sink, washing the dishes, brushing the teeth, washing hands. Does the pregnant person or postpartum person lean their pelvis on the counter? And if they are, what they're doing is they're weakening their pelvic floor and tightening up muscles that shouldn't be too tight. And also thinning out the connective tissue in the abdominal region. So teach your pregnant people to align their pelvis above their heels. The moment they start leaning on the counter or shifting their pubic bone forward is part of a habit. It's a habit they do all the time. And that's what creates too much slack in the connective tissue and not enough support around the joints. So Tadasana is especially important. Breath. A lot of yoga teachers may be taught that pregnant and postpartum people need to do Kegels, the pelvic floor contractions and releases. Kegels are not bad, but if you don't know what's going on in your student's pelvic floor, postpartum or pregnant, when they're pregnant, you could actually be coaching them to do the wrong thing for their pelvic floor. So if their pelvic floor is already very tight, Kegels, what they do is they pull the pubic bone and the tip of the tailbone toward each other. And it causes the pelvic floor to start to droop toward the floor. And that's where you can experience prolapse, where the pelvic organs just drop down. So know that Kegels are only to be prescribed by a physical therapist, for example, a pelvic floor physical therapist, or somebody who has done internal work on the pregnant person or postpartum person. Like they literally have stuck their hand, their finger, or a device to diagnose what is going on in their pelvic floor. So I don't think that Kegels are the best core exercise. I'd say as yoga teachers, stay away from offering that up to your pregnant or postpartum student. Here are some real-time pelvic floor toning activities that your students can do. And you can share this because, you know, a lot of yoga students view their yoga teachers as like life coaches. They just come to you for some advice. And it's like, never give out medical advice. But these are some things that they can do. It's like yoga off of the mat. When they eliminate on the toilet, elevate the feet so that the body is in a squat position. Squatting correctly helps to lengthen the pelvic floor. When you laugh, be conscious about pulling your belly in. Postpartum people who are disconnected to their cores, their belly tends to pop out when they laugh. When they laugh, pull the belly back toward the spine. When there's a need to release gas, as in farting, don't hold it in. That actually makes the pelvic floor tighter and can exacerbate conditions like incontinence or prolapse and DR. When doing bodily actions that increase intra-abdominal pressure, like blowing your nose, sneezing, coughing, untuck your tailbone, move the sit bones back, like into a high chair pose to help lengthen the pelvic floor. When standing at a sink or a counter, move your pelvis back away from the counter. So those are some real-time things that they can do off the mat. And when you have them do their yoga on the mat, it's really helpful to talk about this stuff, like chair pose. This can be a good pose to sneeze in if you are accidentally peeing on yourself when you sneeze, because it reduces the excess pelvic floor tension. And that's what when you have incontinence, that means you have too much tension in your pelvic floor. When you have prolapse, you probably have too much slack. But Kegels are not going to fix prolapse. It's actually turning on the muscles around the sit bone area that will help to address prolapse issues. Obturator internus, so you can look that up if you're not familiar with it, but it's around the sit bone area. And it is a really good pose to, is a really good area to contract if people have prolapse. So imagine like being on your side, just lying down on your side, and your head is propped on your hand like this. Lift, pretend this is my leg, lift the leg away from the bottom leg, and then externally rotate it, contracting obturator internus, and that can help to support can help to tone the pelvic floor to support whatever pelvic organ is prolapsing. That's not a cure-all, but it definitely helps to jumpstart that part of the pelvis so that it can be turned on when they're not in the yoga pose and they're just doing their everyday thing. Foot massages are great for pregnant and postpartum people. A lot of times we don't want to stand with optimal alignment because our feet are tired. So rejuvenate the feet by massaging. And you could even start off your yoga class doing that. It's like, that would be part of the warm-up. Everybody seated on a block or blankets, and they grab a foot and massage their feet. And if it's a small group class, pass around the sesame oil or whatever oil you like. That way people can really rub in the oil into their feet, especially your pregnant and postpartum people. So diastasis recti is not a sign of weak core, it's a sign of excess tension. I'd like to open up this presentation to Q&A. Anybody have questions?
Clay, do you have anything additional for?
Yes, I was kind of eating. Sorry. I have a student that has DR, and she complains of back problems, and she's thinking that that was because of the DR and the weak core. But then you just made the comment it was more from excess tension, not necessarily a weak core. So what are some specific things, like during my core work yoga class, that I could have her do for DR and not the actual core work that we're doing for the practice?
She can without this. Now, this is without me seeing her or working with her.
Yes, ma'am.
So just keep that in mind.
Yes.
Do you teach core work to your class, right? To your regular students?
Yes, ma'am. Yes, ma'am.
Have her keep her head down on the floor and just simply breathe smoothly, like follow your breath cues. If you're saying inhale, then she inhale.
Yes.
If you're saying exhale, she exhale. And are there leg movements during the core exercises?
Just depending on what we're doing. If we're doing elbow to knee or, abs with a block, kind of depends.
She can do all of that. She can do all of that. Yes.
Okay. Just keep the shoulders and head on the floor.
Exactly. 100% of the time. There is a nuance about that even. Lifting the head and shoulders can be beneficial for DR, because lifting the head and shoulders helps to tone the rectus abdominis. And when the rectus abdominis gets stronger, the width of the gap narrows. That's a good thing. So I'm not saying never lift the head and shoulders, but in general, for a yoga group class, it's like just have them keep their head on the floor. And if she's not breathing well, she should not be on her back. That means that she's not ready to be on her back yet. Have her come onto her hands and knees and do pelvic tilts instead. And that's simply isolating the lower back muscles in the pelvis, where they just move their pelvis, tuck and untuck in the pelvis. If you see any movement in her mid and upper back, then she needs to move her pelvis less, a smaller movement to isolate the lower back. If her lower back is so tight that in her attempts to move her pelvis, the rest of her spine starts undulating, then it defeats the purpose of what pelvic tilts is supposed to do, which is toning the pelvic floor and getting the lumbar muscles to be more supple. So I'd say hands and knees.
Yes. Okay. And
then
then
a lot of in my own postpartum, I did a lot of forced yoga abdominals with my head down, and it was very helpful. But it was only helpful when I breathed well. So do check out her breathing.
Okay. Now, is there any poses that they would need to avoid specifically throughout a practice, or
no deep anything? People with DR should not be doing deep back bends, no wheels, scorpions.
Yes.
Baby back bends can be great for DR. Baby
yes.
back bends.
Okay.
No deep twists, because it tugs at the linea alba too much. Linea alba is the connective tissue between the rectus abdominis, both sides of the rectus abdominis. And the linea alba is what gets stretched out too much, and that's what contributes to the DR. So excessive twisting is not good.
What would you consider a deep twist?
Maybe like arm to leg.
Okay.
So I'd say baby twisting. If she's doing a standing twisting pose, have her hand on the floor to the inside of the leg rather than on the leg or to the outside of the leg. That would be a good alternative.
Okay.
And definitely no deep forward bends either, because when you have a gap that big enough to cause pain, the back muscles are smart. They will harden up against that pain. So deep forward bends are too shocking to the tissues in the backside. I'd say like halfway forward bends or 3/4 of the way forward bends, but that's about it. Check that she is able to lengthen her spine no matter what degree of forward bend she goes to. But no forward bends where like she's putting her chest onto her legs. Keep it higher than that.
Thank you so much, Kat.
Yeah, you're welcome.
Kat, I'm curious to know if you see any distinction in the severity of these issues in moms of multiples.
Yes, so it tends to be more severe as you give birth more often.
Mm-hmm.
For example, with inversions, you know, if I'm dealing with a pregnant person who's had like 3 or 4 children prior, even if their uterine ligaments are too loose, I wouldn't invert them, because at that point the uterine tissues are just so loose the baby can just like move around all over the place. So I'd say
Pregnant.
avoid inversions unless the pregnant person says they want to. It's like, listen to them, it's their bodies. DR gap tends to get wider if balance and integration have not been established in the after previous births. So I don't see this in every pregnant person. You know, I know a mom right now who's given birth 3 times. She's fine. And that's because she does pelvic floor physical therapy. She moves a lot. She rarely sits down. That's the key, is just to move a lot.
Yeah.
And have good restful moments in your life, like a good night's sleep, fit in a nap here and there. But the DR gap tends to get worse. Prolapse tends to get worse.
Yeah.
And that's where a yoga practice can help. It's like, get your pelvis above your heels instead of above the middle of your foot or your toes. Carry your weight in a balanced way. And this is where I bring in bone stacking.
Mm-hmm.
You know, it's like, feel for optimal alignment that allows for the least amount of pain and the best quality breath.
Sure. Now,
to answer your question?
Yeah. My follow-up question to that is everything you shared, because I just learned so much in an hour, and does any of this shift for C-sections?
What I said, let's see. It does not. However, I would like to take this opportunity to talk about what to do, what you can do after a cesarean birth, a cesarean section. Pranayama is really great on the first day of surgery, like right after you've had surgery. Things like Kapalabhati is really great. Alternate nostril breathing with no holding of the breath. The Kapalabhati simulates like a cough, and that'll help to move any clots that might be forming post-surgery. And of course, they do need to check in with their provider before they do any of this stuff. It's pretty close to what providers recommend, though. They tell their patients to cough 20 times, you know, like like that. And I find that to be kind of unpleasant. So I recommend Kapalabhati. Let's see here. Doing things like writing the alphabet with your feet, your ankles, on the right after surgery, because you are at risk of clots forming in your legs. So move the circulation, move the blood in your legs. And I don't recommend any core work until, aside from deep breathing and transverse abdominal contractions, until after postpartum bleeding has stopped. So if you've got a student you know just gave birth, ask them, yoga teachers, has your lochia stopped or your postpartum bleeding stopped? And if they want to take class, even with their postpartum bleeding, let them. Just, they've got to modify tremendously and track their level of bleeding. If something that they're doing increases bleeding, they'll feel a gush. It's time to stop and lie down or lie on your side or do pranayama on your back. I do believe you can start your yoga practice immediately after giving birth, whether you have a cesarean birth or a vaginal birth. It just, your yoga practice might not look like what you're used to. So maybe not a warrior two, definitely not a warrior two on the day that you give birth, but pranayama is yoga. Neck release is yoga. Deep breathing, shoulder shrugs, lying down, moving your, pretend this is a leg, a foot here, bend the knee, bring the heel to the butt, exhale, straighten the leg and glide the heel away from the hip. That's a really great core exercise to do. Yeah, so yoga from the moment you give birth is wonderful. I might have overshot your question, but I hope that was helpful. Anybody else have a question?
Hi, I'm Fania. It's not a question, it's more like a comment. And I don't know if you can hear me because I have my headphones on.
I can hear you.
And I don't know if it's something that you experienced. After I gave birth, I didn't do any core work because of the whole, DR. I didn't want it to affect me too much in terms of healing because my fingers, they were going pretty deep and it was like 2 fingers wide. And it wasn't until this summer actually that I started doing core work, and I noticed, I don't know if it was my uterus, but very low, it would get really swollen, like very low on my belly underneath my belly button, and it would be very achy. And I didn't really know how to deal with it or what to do. So I would take a few days off and then kind of, back up next time I was working out or practicing yoga or whatever it was. And I haven't felt it in a while. So I think, everything healed well. But I kind of want to hear, what you have to say about it, because I haven't come across anybody else who has experienced it. So I don't know if you have insight.
Yeah, what kind of core work were you doing? Were you lifting your head and shoulders up?
Yeah, it was actually forest yoga during the teacher training over the summer. So it was, pressing your belly down towards the earth, lengthening your tailbone, and then, keeping your head and your shoulders lifted. Aside from that, though, I started doing rebounding on the mini trampoline and pressing down on the trampoline, keeping your hips pressed back as well. The rebound that you get, it's a huge workout for your whole midsection. And I would notice it then as well.
I would recommend
probably,
I would recommend avoiding any exercises that increase intra-abdominal pressure. So lifting the head and shoulders, it somewhat increases intra-abdominal pressure. So I'm not surprised that you would feel that swelling in the pelvic region that you were describing. It's actually quite common. And jumping up and down on a trampoline, while it's a wonderful overall body workout, that increases intra-abdominal pressure too much. So I'd stay away from that. I would, if you love the four-straight abdominals, consider doing all of them with your head down. Check out that your breathing is very smooth, and it may be, I'm not there with you, so I don't know.
Yeah.
I would replace the trampoline workout with walking consciously. So take off your shoes. If you can walk in dirt or grass, that's really good for your core. Like you walk, touch the heel to the ground, and then bring the rest of the foot down and dig your toes into the ground. then you pick up your other foot and do that. That's actually way more effective, in my opinion, for rebuilding core integration than doing the trampoline in this part of your life. I'm not saying trampoline's bad. I'm saying you need to get your core more integrated before you do really intense advanced stuff like floor stroke abdominals or jumping up and down.
Mm-hmm.
And I would suggest to you, if you can, to get pelvic floor work. So find a really good pelvic floor physical therapist who does internal work as well as scar tissue remediation to help move things along a little faster.
Right.
Does that help?
Yeah, definitely. I never even considered going, and getting physical work done to
Where do
kind
you
of
live?
ease the tension in the area with the right
Where are
side.
you in the country?
In the Inland Empire, Southern California.
Southern California?
Mm-hmm.
Okay, you're in the States like me. Over in Europe, it's like routine to just give postpartum people like 10 pelvic floor physical therapy sessions. It's like normal.
Mm-hmm.
Over here, there's nothing like that. We have a completely different mindset and culture around childbirth. So it's like we have to go seek it out, unfortunately.
Yeah.
Nobody's going to hand it to you. I wish they would, like they do in other countries. But there's a lot in Southern California. If you email me your exact location, I can refer you to somebody good.
Okay.
And you can check and see. Yeah. You can, and I want to put this out there too, because I don't assume everybody has access to a pelvic floor physical therapist. I did not have access to a pelvic floor physical therapist until much later, when I could save up more money. You can do internal work on your own. You take castor oil, put it on your fingers, and then do your own internal work in your own private time. I had a very dear student just recently contact me and say she completely closed her DR gap by doing internal work on her own. And it only took her 2 days to do it. But she had to get childcare for her daughter. She did not take care of her daughter. She just literally had her own personal in-home retreat with nobody around. And she used a combination of mud, external massage on her belly, and also internal massage with castor oil. So pelvic floor work can often help DR to close a lot sooner. I hope that helps.
It's opening up so much right now. It's insane.
Yeah.
Thank you.
You're welcome.
Yeah, absolutely. The tightness on the right side of my body is beyond anything I've ever felt, and this might be, the key to kind of moving that forward in terms of helping it feel more mobile.
Yes. The pelvic floor is amazing. It's so strong. It has such a huge influence over the way our entire body operates. And I think that if we just developed and deepened a relationship with our pelvic floor, literally touched it and breathed into it, it would change a lot of things about how we think and how we feel and our biomechanics. Hold on one moment. Yes, my love? Yes, I can brush your teeth. I'll be right out. Okay, that's okay, love.
Kat, we want to honor your time. And is there anything are we welcome to share your contact, your information with people? Is there anything that you want to share with us?
Feel free to share my contact information. If you want to learn more about yoga for pregnancy and postpartum, I teach trainings all over the country. Just go to poppy.yoga, and it's poppy.yoga. There's information on there about where I'll be teaching these events. I'm also available, if you have questions about the information that I presented on this webinar, just shoot me an email. I'm happy to answer your questions, especially if you have questions about yoga students you're working with or questions for yourself, postpartum or pregnancy. I love this stuff and I want to help people. That's it.
Beyond informative. Thank you so much.
You're welcome.
Yeah, I have 2 full tiny written pages of notes, so
Excellent.
Give us 3. Yeah.
Can have a competition.
That's funny. This reminds me of my breastfeeding days. This was me just scrolling on my phone. A lot of the things that you told us, I was just like, oh, I remember that, reading that at 2 a.m. Yeah.
Yeah. How long,
Thank
can I ask
you.
you a personal question of how long has it been since you've breastfed?
I'm still breastfeeding. I'm actually weaning her still.
Okay. I recommend your postpartum. I recommend no lifting head and shoulders, no jumping on the trampoline, because you've still got lots of relaxin in your system.
Yeah. I was thinking about that when I was listening in. I was just like,
Yeah.
wow, I am working out I'm working my body